Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the mediastinum. What is mediastinum? Mediastinum is the partition between two lungs. These are the group of tissue which are present in between two pleural cavities. This is the median compartment of the thorax. The mediastinum include all the structure in the thorax except the lungs. So the mediastinum are flexible, soft tissue which are present between the lungs. So if I go to the model, okay, so if I go to the model here, this is mediastinum. Lungs are not part of the mediastinum. So mediastinum include the heart, include the trachea, include the arteries, vein, nerves, lymph nodes, except the two lungs. The mediastinum is bounded above by the thoracic inlet. Below it is bounded by the diaphragm. We'll discuss about the mediastinum. We got mediastinum. By definition, what is the mediastinum? Mediastinum partition. This is the partition between the lungs. So we have lung here. This is right lung. This is left lung, and all the structure in between the two lungs, in between the left lung and right lung, forms the mediastinum. So mediastinums are group of tissue between the lungs. So we got the definition of the mediastinum. Now we'll go through the boundaries of the mediastinum. Boundaries of the mediastinum. Okay, mediastinum is bounded by the sternum in front. This is sternum. This is the manubrium. This is the body of the sternum. Okay. So anteriorly bounded by the sternum. Posteriorly it is bounded by 12 thoracic vertebrae, T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12. This is the posterior boundary of the mediastinum. Okay, so boundary of the mediastinum, anteriorly, this is the sternum that forms the boundary. Posteriorly, what is the boundary? Posteriorly, 12 thoracic vertebra. We got anterior boundary, posterior boundary. It is bounded above by thoracic inlet. So this is the thoracic inlet. Okay. We got anterior boundary, sternum, posteriorly bounded by the 12 thoracic vertebra, above thoracic inlet. Below it is bounded by the diaphragm. So below the mediastinum is bounded by the diaphragm, by the diaphragm. Okay, we got the boundaries of the mediastinum. So mediastinums are the collection of tissues, organs, blood vessels, nerves between the two pleural cavities. Lungs are not part of the mediastinum. Heart, the blood vessels, nerves, lymph nodes, trachea, brachiocephalic vein, azygos, part of the azygos vein, okay, and the upper part, lower part, these are the contents of the mediastinum. We'll go through the contents of the mediastinum. So we have gone through the boundaries of the mediastinum as a whole, bounded anteriorly by the sternum, posteriorly by 12 thoracic vertebra, above bounded by the thoracic inlet, below bounded by the diaphragm. This is the these are the boundaries of the mediastinum. Now we will divide the mediastinum for our descriptive purpose. Okay, so how can we divide the mediastinum? We have superior mediastinum, we have inferior mediastinum. These are artificial division, arbitrary division to describe properly the content and boundaries of the mediastinum. So, what is the boundary of superior mediastinum? Boundaries of the superior mediastinum. Okay, what are the boundaries? Okay, bounded anteriorly by the manubrium sterni. This is manubrium, anteriorly bounded by manubrium sterni. Manubrium sterni. The upper part of the sternum is called manubrium. Posteriorly bounded by upper 4 thoracic vertebra, T1, T2, T3, T4. So posteriorly it is bounded by the upper 4 thoracic vertebra. Thoracic vertebra. Okay. Below it is bounded by a plane called transverse thoracic plane. So this plane is called transverse thoracic plane. So the transverse thoracic plane forms the lower boundary of the superior mediastinum. So below the superior mediastinum is bounded by an imaginary plane that is called transverse thoracic plane that extend from the manubriosternal junction or angle of Lewis. We call it angle of Lewis, also called manubriosternal joint anteriorly. Okay, manubriosternal joint anteriorly to the lower border of the body of the transverse process. So from the angle of Lewis or manubriosternal joint anteriorly to the lower border of the body of the T4, there is a transverse plane called transverse thoracic plane. Okay, this forms the lower boundary of the superior mediastinum. So this is superior mediastinum. Okay, we got below bounded by the transverse thoracic plane, transverse thoracic plane, thoracic plane. Okay. Above, how it is bounded? Above, it is bounded by the thoracic inlet. This is thoracic inlet. Above, bounded by the thoracic inlet. So we got the boundaries of the superior mediastinum. Now we have to find out the boundaries of the inferior mediastinum. So this part is superior mediastinum. This entire part below the transverse thoracic plane are all together is called the inferior mediastinum. This is inferior mediastinum, this is superior mediastinum. Okay. So we'll go to the boundaries of the inferior mediastinum. Boundaries of inferior mediastinum. Okay. Bounded anteriorly by the body of the sternum. Okay. Body of the sternum. Bounded anteriorly by the body of the sternum. Sternum. Posteriorly bounded by lower 8 thoracic vertebra. Lower 8, that means T5, T6, T7, T8, T9, T10, T11, T12 thoracic vertebra. Below, bounded by the diaphragm. By the diaphragm. Okay, by the diaphragm. This is the largest diaphragm of our body. Okay. Above, bounded by what? By the transverse thoracic plane. So this is inferior mediastinum. Bounded above by the transverse thoracic plane, extending from the angle of Lewis anteriorly, posteriorly lower border of the body of the T4 thoracic vertebra. So what is the upper boundary of the inferior mediastinum? That is the transverse thoracic plane. Transverse thoracic plane. Okay. We got superior mediastinum. This entire part is the inferior mediastinum. For proper description and understanding the inferior mediastinum, again divided into 3 divisions. Okay. So we are going to the inferior mediastinum. Inferior mediastinum. Inferior mediastinum. Inferior mediastinum. Okay, what are the divisions of inferior mediastinum? We have the anterior mediastinum. We have the middle mediastinum. We have the posterior mediastinum. Okay. So this part is again divided into 3 subdivisions. This is the anterior mediastinum. Anterior. This is the middle mediastinum. That is the heart and the pericardium and the root of the blood vessels. This is the posterior mediastinum. It contains the esophagus, the descending thoracic aorta, the azygous vein, most part of the azygous vein, hemiazygous vein, also the nerves, vagus nerve. We'll go there gradually. So, superior mediastinum, inferior mediastinum. We got the division of the inferior mediastinum. Now we learn the anterior mediastinum and its boundary. So, anterior mediastinum. What is my anterior mediastinum? Anterior mediastinum is anterior to the middle mediastinum. Mediastinum composed of pericardium and heart. It is anterior to that. It is a narrow space between the body of the sternum and the pericardium, or you can say the body of the sternum anteriorly, posteriorly the middle mediastinum. Okay, so boundaries. What are the boundaries of the anterior mediastinum? Boundaries anteriorly, boundary by means of the body of the sternum, body of the sternum. Okay. Posteriorly, bounded by the middle mediastinum. Middle mediastinum we can call the pericardium here, pericardium. Okay, we got anterior boundary, we got posterior boundary. What is the upper boundary? Above, that is the transverse thoracic plane. That is the transverse thoracic plane. Okay, transverse thoracic plane. Okay, below we have the diaphragm, bounded by the diaphragm. Okay, we got the anterior mediastinum. Okay, boundaries of the posterior mediastinum. Okay, anteriorly bounded by the middle mediastinum, or you can say pericardium, middle mediastinum, or we can call pericardium, because middle mediastinum is composed of heart and pericardium and the root of the great vessels. Posteriorly bounded by the lower 8 thoracic vertebra. Okay, posteriorly bounded by what? Posteriorly bounded by lower 8 thoracic vertebra. Thoracic vertebra. Above bounded by what? Transverse thoracic plane. Below bounded by the diaphragm. Okay. So what is the boundary of middle mediastinum? Above by transverse thoracic plane, below by the diaphragm, posteriorly by the posterior mediastinum, anteriorly by the anterior mediastinum. So we got the boundaries of the mediastinum. Okay. Now we go to the contents of the mediastinum. Okay. So we learn the contents. Contents of the superior mediastinum. Superior mediastinum. Okay. So we have muscles there. What are the muscles? We have the sternohyoid, sternothyroid, and longus colli muscle. Sternothyroid, sternohyoid, and longus colli muscles. We have the arteries. What are the arteries? Content of superior mediastinum. What are the arteries here? We have muscles here. Sternohyoid, sternothyroid, longus colli muscle. Sternohyoid, sternothyroid. We have the longus colli muscles. What are the arteries? The arch of the aorta and its branches. What are the branches of arch of aorta? We have the brachiocephalic trunk, brachiocephalic trunk or brachiocephalic artery. Okay, we have the left common carotid artery. We have the left subclavian artery. Okay, we got muscles, we got arteries. Now we'll get the veins. What are the veins present in the superior mediastinum? We have the left and right brachiocephalic vein, left and right brachiocephalic vein, brachiocephalic veins. We have the upper part of the superior vena cava, upper part of the superior vena cava, okay. We have also the superior intercostal vein, okay, superior intercostal vein. So these are the veins present in the superior mediastinum. Okay. So we got the muscles, we got the artery, we got the vein. We will get we have some tubular structure, like we can say tubes. What are the tubes? We have the trachea, esophagus, and we have the trachea and esophagus. Then we have nerves. What nerves? We have nerves in the superior mediastinum. Nerves. We have the phrenic nerve, vagus nerve, and left recurrent laryngeal nerve. We have the phrenic nerve. We know the root value of phrenic nerve is C3, C4, C5. We have the vagus nerve. That is the 10th cranial nerve that comes out of the medulla oblongata, content of carotid sheath in the neck. Then it is a content of superior mediastinum, content of posterior mediastinum. Then it forms the esophageal plexus, enters the abdomen through the esophageal opening of the diaphragm as anterior vagal trunk, posterior vagal trunk, and it is distributed to the structures in the head and neck, thorax, as well as in the abdomen, up to the splenic flexure of the large intestine, junction between the left 1/3 and right 2/3 of the transverse column. Okay, phrenic nerve, vagus nerve, and left recurrent laryngeal nerve. That is a branch of vagus nerve, laryngeal nerve. Okay, we got the nerve. Then we'll get the glands. Okay, what are the glands present in the superior mediastinum? Our gland is the thymus gland. Okay, thymus gland. Duct. Superior mediastinum also contains the part of the thoracic duct. So we got the contents of the superior mediastinum. We got the muscles, artery, vein, nerve, tubular structure like trachea and esophagus. We also get some lymph node like pretracheal lymph node, paratracheal lymph node. We can write it here. Pretracheal and paratracheal lymph nodes. Paratracheal lymph nodes. Okay, so we got the contents of superior mediastinum. Now we'll go to the contents of anterior mediastinum. Okay, contents of anterior mediastinum. Anterior mediastinum is the smallest of all mediastinum. It contains sternopericardial ligament, sternopericardial ligaments, okay, that connects the sternum and the pericardium. Okay, it contains the mediastinal branches of the internal thoracic artery, mediastinal branches of the internal thoracic artery. Okay, it contains loose areolar tissue, contains lymph nodes, and it may contain the thymus, especially in children. It may or may not contain the thymus. So that is these are the contents of the anterior mediastinum. We'll go to the contents of middle mediastinum. Contents of middle mediastinum. So again, go to the boundary of middle mediastinum, bounded anteriorly by the anterior mediastinum, posteriorly by the posterior mediastinum, above by the transverse thoracic plane, below by the diaphragm. Okay. So contents of middle mediastinum. What are the contents? Certainly we get different contents here. Okay, like that of the pericardium. Okay, heart certainly is the most important content, and root of the great vessels like ascending aorta. Ascending aorta. We know the ascending aorta has two branches, left coronary artery and right coronary artery. Ascending aorta. Okay. We'll get the pulmonary trunk. And its division, left and right pulmonary artery. We'll get the pulmonary veins. Okay, so we got pericardium, heart, ascending aorta, pulmonary trunk, pulmonary veins. Okay, and certainly pericardium, heart, these structures, plus we'll add the phrenic nerve as a content of middle mediastinum. Phrenic nerve is a content of middle mediastinum. Okay, we got the contents of middle mediastinum. Okay, so we have the pulmonary trunk, pulmonary vein, phrenic nerve. Certainly we'll also add the superior vena cava, lower part, superior vena cava, and just the termination of the inferior vena cava, termination of inferior vena cava. So these are the contents of the middle mediastinum. We got the contents of the middle mediastinum. Now we'll go to the contents of the posterior mediastinum. So this is middle mediastinum. This is anterior mediastinum is here. This is middle mediastinum. These are the contents of the posterior mediastinum. Okay, posterior mediastinum, middle mediastinum, anterior mediastinum. So this is anterior, this is middle, this is posterior mediastinum. This is left lung with one fissure, right lung 2 fissures. Okay, we got the contents of the middle mediastinum. We'll go to the contents of the posterior mediastinum. Okay, so posterior mediastinum content will be different. Okay, number 1, major contents posteriorly: the descending thoracic aorta, descending thoracic aorta and its branches, We have the azygous vein, okay. We have the content thoracic duct, content esophagus, okay, and splanchnic nerves, okay. Remember, splanchnic nerve some anatomists don't accept as a content of posterior mediastinum, but we like to add here. Cardiac nerves are the contents of the superior mediastinum. Splanchnic nerves are contents of the posterior mediastinum. Okay, we got descending thoracic aorta and its branches, and certainly we'll get lymph nodes, the posterior mediastinal lymph nodes, we'll get the esophageal plexus of nerve, nerves is a content of the posterior mediastinum. Okay, we got artery, we got vein, we got lymph node, thoracic duct, esophagus, the splanchnic nerve. Okay, we have to know that it also contains the vagus nerve. Okay, very important, vagus nerve that contribute in the formation of the esophageal plexus. Okay, we got the contents of posterior mediastinum. Now we like to learn the applied anatomy or the clinical anatomy of the mediastinum. Mediastinum are a group of structures in between the lungs. They are closely placed together by means of small amount of loose areolar tissue. So any pathology in one of the organ may affect the function of another organ. Okay, so our mediastinum, middle mediastinum is here, anteriorly bounded anterior mediastinum, posteriorly by posterior mediastinum, below by the diaphragm, above by the transverse thoracic plane. So we may have widening of the mediastinum, widening of the mediastinum. Okay, if you take an X-ray, we'll get that widening. It may be due to cardiomegaly. Okay, due to cardiomegaly, heart is enlarged. There may be left ventricular hypertrophy or biventricular hypertrophy. Okay, cardiomegaly. So the mediastinum may be wider. It may be wider due to pericardial effusion. Okay, or cardiac tamponade that happens very quickly. Cardiac tamponade. Okay. You may have a tumor in the mediastinum. Okay, so that may also widen the mediastinum. There may be anterior mediastinum tumor is also possible. So pericardial effusion, cardiac tamponade, or aneurysm of the aorta, aneurysm of the aorta, these all are the causes for widening of the mediastinum. Okay, we got that, widening of the mediastinum. Then, as because many structures are close together, if the esophagus is compressed, we'll get dysphagia. Dysphagia, difficulty in swallowing. It may also happen in mitral stenosis, left atrial hypertrophy, or esophageal cancer, or any other compression to the esophagus. Dysphagia. We may have dyspnea, difficulty in breathing if the respiratory passage is blocked by a tumor or any large lymph node or collection of blood. Okay. Dysphagia, dyspnea, difficulty in breathing, difficulty in swallowing, that is possible. Okay. We may have hoarseness of voice. Hoarseness of voice. This may happen due to irritation to the recurrent laryngeal nerve by a lung cancer. Okay. So the larynx cannot produce normal phonation. We'll get the hoarseness of voice due to irritation to the recurrent laryngeal nerve. We may have back pain. Back pain is possible due to erosion of the ribs by the blood vessels, especially in coarctation of the aorta or any other growth in the vertebral column. Okay, that may erode the vertebra and that may cause back pain. Okay, so these all are the mediastinal syndrome. We call them mediastinal syndrome. Okay, mediastinal syndrome. Okay, so we may have dysphagia, dyspnea, hoarseness of voice, back pain. Okay, we may have engorgement of the head and neck vein. Okay, engorgement of the head and neck veins. This may happen if the superior vena cava is obstructed in cardiac tamponade. That may happen. Engorgement of the head and neck vein, especially in cardiac tamponade. Superior vena cava and the right atrium is compromised. Okay, these are called mediastinal syndrome. Okay, then we have a terminology called mediastinoscopy. Okay, so mediastinoscopy. Okay, a physician can go inside the mediastinum by endoscope, usually behind the jugular notch or between the ribs. Okay, and can find out the lymph node enlargement, especially the mediastinal lymph nodes. Okay, or anything wrong in the bifurcation of the trachea. Okay, so that may be identified by mediastinoscopy. Okay, so again we have to go the boundary, superior transverse plane. It is very important plane, and this plane, superior mediastinum, is differentiated from the inferior mediastinum. Inferior mediastinum has three parts: anterior, middle, and posterior mediastinum. Okay, a lot of thing happens in the transverse thoracic plane. Okay, what happens at transverse thoracic plane? Okay, this plane is an imaginary horizontal plane from the angle of fluis or manubriosternal joint anteriorly to the lower border of the T4 thoracic vertebra. What happens? Okay, so transverse plane, bifurcation of the trachea, bifurcation of the trachea this happens. You must remember that the location of bifurcation may be a little bit variable in lying position and standing position. In standing position, it is a bit lower. Okay, so arch of aorta begins and continued as the descending thoracic aorta. Descending thoracic aorta. Okay, we got important landmark, transverse thoracic plane, the imaginary demarcation between the superior mediastinum from the inferior mediastinum. Okay, we have multiple structures that actually, those are actually present, that run between multiple mediastinum. Suppose phrenic nerve, we can say structure passing through multiple mediastinums. What are the structures? Like phrenic nerve, vagus nerve, thoracic duct, esophagus. Okay, so they passes through multiple mediastinum. Phrenic nerve is formed from C3, C4, C5 is the content of the neck, content of the superior mediastinum, content of the middle mediastinum, and it innervates multiple structure like that of fibrous pericardium. It innervates the diaphragm, it innervates the mediastinal pleura, and the right branches of the right, and the branches of the right phrenic nerve also innervates the gallbladder. So phrenic nerve mostly innervates the diaphragm, it also innervates other structure. Vagus nerve, so this is a phrenic nerve, the content of neck, content of superior mediastinum, content of middle mediastinum, and it reaches the diaphragm under surface in the abdomen. Vagus nerve, it is a content of the posterior cranial fossa from the medulla oblongata. Okay, so it is the content of carotid sheath here. It is a content of neck, content of superior mediastinum, content of posterior mediastinum, and it is a content of abdomen. It forms esophageal plexus, and we have anterior vagal trunk, posterior vagal trunk that enters through the esophageal opening of the diaphragm at the vertebral level T10. Okay, then thoracic duct, it is formed at vertebral level L1 in the abdomen, content of superior mediastinum, content of root of the neck, and the lymph ultimately dumped into the junction between left internal jugular vein, left subclavian vein. Esophagus, it is formed in the neck from the lower part of the laryngopharynx. It is a content of neck, content of superior mediastinum, content of posterior mediastinum, and it is also partly content of the abdomen under the esophageal opening of the diaphragm. Okay, it at the esophageal opening of the diaphragm at the level of T10, it enters the abdomen, and under the diaphragm it has a short course, then it continued as stomach. So structures passing through multiple mediastinum, we have gone through this. So that's all about the mediastinum. If you have any question, please feel free to ask me, and please subscribe.